A very good evening, everyone. Thank you so much for coming and welcome to today's extremely special session of the Sphere India COVID-19 Academy. We're so excited to have you all present here with us today to celebrate the International Nurses Day. Well, happy International Nurses Day, everyone. As you all know, the name of our session today is Challenges Faced by Nurses and Midwives During COVID-19 and the Way Forward. And in this session, we'll hear perspectives from the government, regulators, and professional associations, representatives of which are all here with us today. Let me now quickly introduce our two moderators for this session, who will then be able to take it forward. Our first moderator today is Dr. Dilip Singh Mairamba. Dr. Dilip is the National Professional Officer for Health Workforce at WHO India. He's a medical doctor with a master's in health systems management. And he started his career as a critical care physician and in 2001 moved to public health with primary healthcare service delivery in tribal areas. And since then, he has worked progressively at the regional and central level, supporting state governments towards health systems strengthening. His major contribution is in research and technical guidance to improve healthcare workforce practices, particularly for the nursing and midwifery cadre. Welcome, Dr. Dilip. Thank you for agreeing to moderate today's session.
Thank you.
Thanks, Dr. Dilip. Our second moderator today is Ms. Pragati Sharma, also from WHO India. And I'm sure you all know Pragati by now, but just in case you don't, here's a brief introduction. Pragati is a nurse midwife who is passionate about quality, equitable, and respectful care for maternal and reproductive health. She's a public health graduate and has a range of experience in public health in the SRM and CAH area in India and overseas. She's also a graduate in public policy from the University of Oxford, and her experience includes working in policy and planning, program implementation and evaluation, research and capacity building. Her professional association has been with UNICEF, Chapaigo India, WHO headquarters, and so many more. At present, she's working as a national consultant for midwifery with WHO India. Thank you, Pragati, for all of your support during this week. Now I'll just hand it over to you to take the session ahead. And the floor is yours, Pragati. Thank you.
Thank you, Astha. And I wish you all a happy International Nurses Day to everybody who's present here for the session today. International Nurses Day is celebrated each year around the world on 12th May, which is the birth anniversary of Florence Nightingale, the contribution nurses make to the society. Florence Nightingale was the founder of modern nursing, an English social reformer, a statistician, and an infection prevention champion. She gave nursing a highly favorable reputation and became an icon, the lady with the lamp, like how we know her, while making rounds to observe the status of wounded soldiers at night. Let us get to know who Florence Nightingale was in this short video.
Right, just give me a second. I'll start sharing my screen.
Sure, Astha.
I hope it's visible.
Yes.
Great.
Florence Nightingale was a British nurse who is considered to be the pioneer of modern nursing. Florence was born in 1820 and named after the city she was born in, Florence, Italy. She was raised in England at the family's Embley Park home. She loved to read, write, and do math. Her parents hoped she would get married and start a family, but Florence had other dreams. She wanted to help people, so she decided to become a nurse. Florence believed that cleanliness was one of the most important things needed when healing a patient. She was such a skilled nurse that she trained other nurses. She had a habit of checking on patients during the night while holding a lamp and earned the nickname Lady with the Lamp. Florence's biggest contributions came when she heard about the horrible conditions for the wounded soldiers during the Crimean War between England and Russia. In October of 1854, Florence and 38 other nurses she had trained were sent to Scutari, Turkey, to the English military base. When the nurses arrived, they saw that there wasn't adequate medical supplies. Patient hygiene was being neglected, and the current staff was overworked. Florence sent word back to England that the conditions were terrible. The British government sent back building supplies so that a new hospital could be built. Once the hospital was built and Florence started new nursing practices, the death rate went from 42% to 2%. After the Crimean War, Florence came home to England and began the Nightingale Training School to train nurses. She also wrote notes on nursing, what it is and what it is not, which is still considered to be an important book on nursing. In the book, she talks about the importance of fresh air, light, warmth, cleanliness, quiet, and diet in the healing of a patient. Florence even had a hand in helping nurses during the Civil War in America. She was asked by the United States government to give them advice on how to set up a proper hospital for taking care of wounded soldiers. She was considered an expert in wartime nursing. Florence Nightingale is still considered one of the founders of modern nursing, and her practices are still used today.
Thank you, Asta, for sharing the video. Even today, Florence Nightingale teaching is also appropriate in the relation to the ongoing COVID-19 pandemic. And Florence Nightingale Healthcare found its first infection prevention champion. The result of her research in hospital sanitation made her an advocate for pure air, pure water, efficient drainage, cleanliness, and better lighting. Her advocacy in prevention led to standards of cleanliness and sanitation in hospitals and military. 2020, this year, 2020, is special in two ways. It marks the 200th birth anniversary of Florence Nightingale. 2020 is also designated as the International Year of the Nurse and the Midwife by the World Health Organization. Now, we'd like to ask you, how many of you were aware that this year is the International Year of the Nurse and the Midwife? Asta, could you please launch the poll here, please?
Yes, of course.
That is cool.
Here we go. I'll share the results.
Okay. Yes. This is great. It shows that 83% of you did know that this year is the International Year of Nurse and the Midwife, and more power to all of you present over here to spread messages and respect and support nurses and midwives all across the country and the world. 2020 is, yes, the International Year of the Nurse and the Midwife, and it is also recently declared that this entire decade of 2020 will be the decade of the nurse and the midwife as well. So here's a good news that I wanted to share with you all today. Now, moving forward for our session today, in the light of COVID-19 pandemic, which is about the challenges faced by nurses and midwives during COVID-19 and the way forward. The session focuses on understanding the perspective of the government, the regulatory body of nurses and midwives in India, the Indian Nursing Council, and professional associations like TNAI and SOMI. We will discuss about the challenges faced by nurses and midwives working during COVID-19 across all settings, be it academic, clinical, public health, community, and more. In addition, we will also hear the special experience of an IAS officer in introducing professional midwifery services in Telangana, which was first of its kind in India. She will highlight on her experience and challenges faced while navigating this process in Telangana. Our panelists today are, we have Ms. Bhakati Karuna, Officer of the Indian Administrative Service, Telangana Cadre, Government of India, Dr. Rati Balachandran, Assistant Director General, Ministry of Health and Family Welfare, Government of India, Dr. T. Dilip Kumar, President, Indian Nursing Council, Professor Dr. Roy K. George, National President, Trained Nurses Association of India, Mrs. Manonmani Venkat, Advisor, Society of Midwives, India, Ms. Mansi Jana, President, ANSWERS, which stands for Academy of Nursing Studies and Women's Empowerment Research Studies. Now, I will hand over to my colleague from WHO India Country Office, Dr. Dilip, to take the session forward with our panelists. Over to you, Dilip.
All right. Thank you so much, Pragati. I have a small complaint, though. If we had a little more time for the polls, you would have probably got a more overwhelming response. Yeah, I was looking at, we have
Okay.
almost more than 370 participants.
Oh my God, it's double.
Yeah,
started
so
it
we.
was only 200.
Exactly, Dr. Dilip. This is Asta. It was an automated.
No. I'm
Okay.
just kidding. Because hardly 60 odd people go to vote. So we have such an overwhelming kind of attendance over here. All right. So, let me just set the ground rules a bit. First of all, we understand that the first speaker will probably not be, though as much as we would like her to, may not be staying the whole length of the program. So we will start with her presentation and also end her presentation with certain, big ticket questions that you have for her. And then we move on to the other panelists. At this point, I would like to remind you of a couple of things. The sessions we are limiting to about 5 odd minutes for all the participants. And as far as the questions are concerned, I suggest and I request all the participants to kindly keep the chat box free for the time being and limit that to the questions that you would like to put forward to the panelists or the speakers for the day. And it would be very helpful for the team over here if you can also indicate to which panelist or speaker you are addressing your question, so that at the end of when all the speakers have spoken, we can try and make some sense out of all the questions that come in and take a few of them at the end of it. And we also, if there are people who are not able to type in but feel that you have a very important matter to be addressed, kindly raise your hands. And also somewhere there's something called raise hands or something, and the admin here and Pragati will kindly take note of that, and then we can proceed from there. All right, so this indeed is a very historic day, and I welcome you all to this. I wish we could have done it in a better way, in a much bigger way, but we are bound by the constraints of the day that we live in currently. And so I extend my warm welcomes to now about 400 participants that we have online. All right, so on such a historic day, it is, I think, very appropriate that we start with a speaker who's going to talk about strengthening the midwifery cadre in the state of Telangana. And for this, I would like to invite Ms. Vakati Karuna, who is an Indian Administrative Services Officer of the Telangana cadre. She has more than 20 years of experience working at different administrative positions for public health, land reforms, rural development, poverty alleviation, natural resources management, revenue and judiciary. Well, it can't get more diverse than this one here in the state of Telangana and in the erstwhile undivided Andhra Pradesh. She worked on several collaborative projects of the World Bank, the DFID, the FAO, the WHO. Well, that's good, and the UNICEF as well. She was awarded by the state government of Andhra Pradesh and Telangana for excellent performance and good governance. Ms. Karuna spearheaded the first midwifery pilot in the public sector, public health sector in Telangana in the year 2018-19. I would like to now hand over the floor to Ms. Karuna. Thank you.
Thank you, Dr. Dilip.
Thank you, ma'am.
Happy International Nurses Day to all of you. And it's such a pleasure to be amongst so many public healthcare specialists and activists. And I've missed this the last 1 year that I have not been in the public healthcare. I have worked in healthcare for
7, 8 years, very, very specifically. My interest began when I was a district collector, and I realized healthcare is where maximum out-of-pocket expenditure happens. So when you talk of development, when you talk of putting money into the pockets, on one hand, the money is going out of the pocket. So I started working on healthcare, and specifically on the issue of deliveries, because for a rural woman, it not only meant that her family goes into a debt trap, because in Telangana, and that time the erstwhile Andhra, the expenditure is anywhere between 30 to 40,000 rupees. Not only that, you also had a huge number of C-sections happening, and followed by a huge number of hysterectomies in very early 30s. And all of you know, as public healthcare specialists, what hysterectomy to young women meant in terms of emotional, physical, and psychological aspects. So I started working on deliveries as a district collector. We increased the number of deliveries. Then I was posted as Commissioner of Health in the state of Telangana. And for me, as an administrator, I faced a few challenges. One is the availability of gynacs and specialists in the remote areas. NHM did give us the money, open-ended amounts, to be able to pay to anybody who came. Can you hear me? Am I clear?
Yes, very clear.
Yeah. So on one hand, NHM did give us an open hand to say you can pay how much ever that is required for the specialists. Then you advertise in papers. Nobody really goes to a remote tribal area. No gynec is ready to go and work in a remote tribal area. And secondly, even if there was an availability of a gynecologist, for me, the moral dilemma was that the numbers were increasing, but it didn't mean increase in natural births. It meant increase in C-sections. And Telangana is the highest in the whole country. So for me, administratively, I realized that if I needed a solution, one is for increasing the deliveries, and we had a special program, the Chief Minister's KCR kit, where we started giving incentives to rural women. So in a span of 10 months, we increased the number of births by 30%. So from a share of 35% of the deliveries in Telangana, in public facilities, it went up to 60% in 10 months. So it was a huge challenge for us. And for me, and then also availability of these doctors. So for me, administratively, I came to a point where I kind of thought that having more and more doctors would not be a solution, because one is they were never going to be available. And two, even if they were available, this whole issue of natural births, etc. And that's when UNICEF, the local UNICEF, Dr. Sanjeev, who was heading it at that time, Evita Fernandez Foundation, we all were sitting and discussing. And then I realized, I spoke to the public healthcare specialists, and this whole thing of midwifery and how it was gaining ground everywhere. And so that's when we started discussing it. And then we worked around a program, and Government of India was very positive as well, about how do we introduce a midwifery, but not taking in a special cadre, but having our own nurses to train, get them trained as midwives, and placing them in the remote areas. So one is you have increased safe births in the remote areas, and the other is obviously have more in number. So that's how it started. So shall I continue, or?
Yes, please, kindly go ahead.
Yeah. So we chose Karimnagar. Karimnagar is, sorry, my headphones are the problem. Karimnagar is the highest. We had 85% C-sections as a percentage of the births that were taking place. Karimnagar in Telangana is a very rich, prosperous area. So we had to turn the tide around to have more natural births and have more of our staff trained in safe medical practices. nurses. So we had a wonderful collaboration with UNICEF and the Fernandez Foundation and Government of India. And it was a great privilege for us to take the first 35 amongst our nurses. We had within our nurses, we advertised and called for interviews, had a written test, called for interviews, and we took them in. And I'm happy to tell you that Government of Telangana subsequently had sanctioned about 125 midwifery posts, and we took them through this training, very, very rigorous training on various aspects. You know, I'm not a public healthcare person, all of you are, so you can understand the the kind of various aspects of safe birthing, and we took them through not just theory but practical as well. We took nurses who had a minimum of 5 years of experience and who were interested in this. So we gave them an incentive package, and right now they're all there in the remote areas, and we took them from the areas where they came from so that they would not have an issue of posting, etc. So in my view, for a country like India, which will always have the problem of availability of good doctors and safe births in remote areas, having midwives, trained nurses who will be specifically trained for. And I should tell you that along with midwifery training, we also introduced respectful maternity care. We brought out a government order to respect the privacy of women. You have these large government hospitals with these windows open, no privacy whatsoever. So we introduced a whole lot of measures of training for respectful maternity care, and I'm very happy to have been part of the initiative. Yeah, thanks.
All right. That was such an interesting and very inspiring story that we heard from you. My take is because it's been an entirely complete package. You know, if I remember correctly, you were speaking about training them. You talked about increasing positions. So in terms of you increasing the skills as well as the numbers available, you had incentives over there built in, and then of course the NHM money does help. It's very, very flexible. And then lastly, you spoke about being backed by regulations. So all these initiatives were backed by regulations to ensure privacy, among others, and I'm sure there must be much more. It was really inspiring for me, for someone who's worked in this field for a very long time. You did also mention Dr. Sanjeev Upadhyay, working with you from the UNICEF. We also go back a long way. We were from the same medical college, and he was my senior in school. Maybe you should, if already you haven't, you should collaborate with him and write a paper on this. It will be such an interesting read for many of us who work in this field and who have the same kind of faith and belief in midwifery being the agent of change in terms of institutional delivery, safe childbirth, motherhood, etc., immunization for that matter. Yeah, ma'am.
And can I just say, Dr. Evita as well, you know, she's all heart and she's all passion. So
well, of course, the two of them.
Yes.
Okay. Thank you so much, ma'am. So I would also like to bring in Pragati over here, my colleague, in case she has anything to add, and if she's seen something coming up on the chat box that she would like to share with you or ask you. Thank you.
Thank you.
Thanks, Dilip. I see one question about creation of posts for midwives as independent practitioners. So, ma'am, if you'd like to take that question.
Yeah. Well, you see, what I did was, like a lot of our bureaucrats do, I did a little bit of jugaad in the sense that the number of births were increasing and the government was getting a very good name because of the KCR kit and etc. So the CM in one of the meetings, we were telling him as to how we are all pressurized, because of the number of posts. So he said, how many posts do you want? And we said, I need this many, because we were showing him some figures. So he kind of sanctioned 4,000 posts. So when he said by tomorrow we'll issue the GO, then we put in this 125 midwives as well. So I would say that they're not exactly independent practitioners. We didn't want, you all know that, you have these very well-established cadres and unions, etc. So we didn't want this one. It was a separate stream which was created for the existing nurses. So it was not as if we were taking in some rank outsiders. We are taking in the nurses who are already there in the system, but who would be given an opportunity for an upward mobility.
Thank you so much, ma'am. There's one more question from Mr. Nasir, where he asks, was there any resistance in propagation of midwifery observed from professionals involved into C-section birth procedures? So I think what he means is, was there the resistance from doctors?
Yeah, no, not really, because we had in that particular year, we took it into a framework of this whole thing of natural births, increased number of births in public facilities, and this respectful care. And so we were already talking and discussing. So we evolved an ecosystem within which all this was happening. So everybody was on board. There could have been some resentment from some quarters, but the overall ecosystem was such that everybody was on board as far as, because we were also pushing the doctors also to come on board for natural birth. We were looking into C-sections. We had developed charts and mandatory forms to fill in when you're going in for a C-section. So we are tightening it from that side also. So
thank you so much, ma'am. We do have many questions coming, but I think we'll take this one and end the first part of this session. The last question we are taking is, did the nurse midwives willingly move to remote areas? And if they did, what were the incentives that were given to them?
Yeah, so again, we did one, when we were advertising, we took people from those remote areas, only for nurses from those areas, broadly those areas, so that when we were posting them back, it was not too much of a movement or too much of a, dislocation for the nurses, because, you can't have 100 things going at one go. You need to prioritize and push them. So the first lot, we took them from the areas where they were from. So incentives were there. There was one increment extra for the midwives.
That's great. Thank you so much, ma'am. Now I hand over to Dilip to take the session forward. Thank you.
Thank you once again, ma'am. I really wish we could have spent more time on this very interesting initiative of the state. But I do hope in the very near future, when things get back to paranormal, if not normal, I get to meet you somewhere in Delhi, or if I come down to Hyderabad and maybe spend more time learning from your experience.
Thank you, Dr. Dilip. It's been a pleasure.
Yes, ma'am. And as much, maybe if you're also in the lockdown like us, I would request that you stay with us, because we have a lot of eminent speakers up next. Stay on for as long as you can, and also raise some questions.
I will. Thank you so much.
All right. Thank you so much, ma'am.
Thank
All
you.
right. So we move ahead from here. To the speakers, 5 minutes was the notional, but why we requested to for the timelines was that, because see, there are so many things that the participants today would like to know from you, and the reason for the time keeping was so that they also have more time to interact with you and learn from you on the certain queries or ideas that they have. All right, so we move on next. To the panelists of the day, of which we have 5 of them rather. We start from the government side, from the Ministry of Health and Family Welfare. We have Dr. Rati Balachandran, who is the Assistant Director General of Nursing. She's been in this position since 2015. She has a master's and a PhD in community health nursing. She also has various national and international publications to her name. Dr. Rati has memberships of many professional bodies like TNAI, SOMI. Well, these two you're going to hear from today, later, the representatives. And then also other professional bodies like INNA, Sochini, CNCL, etc., etc., etc. She has an experience of about around 27 years and has carried out various scientific studies and guided 15 scientific studies carried out by undergraduate nursing students. Before she joined the Ministry of Health, she was a senior faculty in College of Nursing, Dr. Ram Manohar Lohia Hospital, New Delhi, for a very long period, starting from 1996 to 2015, till she joined the Ministry of Health. I hand over the floor to Dr. Rati then. Thank you. Is she there?
You see?
Oh, yes, I can see you.
Thank you, Dr. Dilip.
Thank you. Thank you so much. Yeah, please carry on. Go ahead.
Organizers also, it's an honor to extend the greetings of Ministry of Health and Family Welfare and supplement the greetings to all nurses in the International Nurses Day and in the Year of Nursing and Midwifery. In the midst of the COVID pandemic, the contribution of nurses are being beyond that. Each and every individual are praying for the nurses and appreciating their contributions. They are included in their prayers and wishes. So this year, there were lots of robust plan was there from the Ministry of Health to acknowledge the contributions of nursing but the unfortunate outbreak of this pandemic, even though we are not celebrating in that way which we planned, everyone is acknowledging the contribution and the commitment of nursing. I'm proud to be a nurse, and I appreciate everyone for selecting this profession and following the path of Florence Nightingale in reaching the unreached and also making it possible to take care to everyone in this critical period also.
Excuse me, Dr. Rati. I'm getting some chat saying that probably they would like to see you. If you can switch on the video, is that possible?
I was not able to understand. I think
we can see a photograph, but your video is not visible to us.
Is it?
All right. Oh, there you are. Okay, great. I think Leela is happy now. Leela Verki was wanting to see you, I guess, one of the many who wanted to see you. All right, thank you. Please carry on.
So Government of India is committed to make the best possible for the nurses. And today in morning also, the Honorable Health Minister spent time with the nursing representatives, and the Prime Minister himself have expressed the thanks, and also by his advice, suggestion, the whole country has appreciated the contribution of nurses. But the COVID has made the life of nurses also miserable along with the others. I appreciate the commitment and the sufferings that you are facing through, and also the adjustment the family members are making for helping you to give the best to the people of your calling. Through this platform, I also remember all those nurses of our family who have lost us during this fight. The day from the first case of COVID has come, government has geared up towards doing the best for protecting the public through you, the nurses. There are different high power committees of high power groups have been set up by the government, and doing the things so that you are being protected and you will be able to give the best to the people. To say few, there was some ordinance, or ordinance also was being prepared by the government for making the safety of healthcare providers. That is, a legislation was brought by the union government that makes violence and harassment against the healthcare workers a non-bailable offense. There is zero tolerance for the violence against healthcare services. That shows the commitment of government. Then life insurance cover is another initiative provided, that is Pradhan Mantri Garib Kalyan package, where the premium is being provided by the government to all healthcare providers, be it from the doctors to the lower level. Anybody who has involved in the COVID have lost a life or in major problems, then it is covered under the life insurance. There is also medical safety made possible for the people, healthcare workers, such as through the hydroxychloroquine as well as PPE and N95 and other various measures, which was which was also made available for the people, both from outside as well as indigenous preparation is also encouraged, so that now we have reached to a state that it is meeting our requirement. This is a new disease with few we know, and we are all learning day by day. So according to the learnings and the findings, there were many advisories prepared by Government of India, which is catering to each category of people, be it for the public or for the healthcare workers. Then guidelines were also prepared, so that there is a match between the requirement as well as whatever is required possible. A dedicated toll-free helpline was also provided, that is 08046 110007, which was also manned by the healthcare professionals and psychological experts, including psychiatric nurses, to meet the psychosocial problems associated with this disease because of lockdown or because of the fear and anxiety associated with disease. The most important protection, that is the training. Knowledge is power, and that is the armor against this infection. So government has taken initiative to train and capacity building of all healthcare workers, and nurses being on the forefront, especially with regard to the PPE, how to use donning, duffing. So all series of topics were covered through various platforms. The states were also supported, and each institution were also given guidelines and support for giving training national level through webinars and through the associations and through councils and through the government missionaries. The training were provided to the people so that they were able to protect themselves as well as prevent hospital acquired infections or spread of infections. There was a dedicated integrated government online training. I got Diksha platform of the government was also created to ensure that uniform training is conducted for healthcare professionals across the country. The roles of the healthcare team was mapped, and what are the topics required for them was given accordingly, and so that best use of human resource was also ensured by the expert group, high power group for that. Staffing guidelines and timely payment are few other things. That communication was sent to the states for effective utilization of staff, and the guidance notes were provided to the people for timely payment. And time to time, whenever the grievances were there, all those things were taken care through various platforms, so that the best possible working atmosphere was provided for the nurses. These are few initiatives which is provided with regard to COVID and the challenges for the COVID. Apart from that, Government of India is doing the best for providing the nursing is of prime attention in the Government of India initiative, and we can see that critical care nursing, community health officers under Ayushman Bharat, midwifery cadre, scope of practice. These are few steps with the help of regulatory body as well as association. And the most important one, an expert group was set up to set the minimum salary and wage as well as the working conditions for nurses working in the private organizations also to be taken care. For all these things, the three pillars of any profession, like for any profession, for us also, the three pillars, which is the government authority, as well as the regulatory body and the associations are working together. So the platform is there, every commitment is there, everything is comfortable, and the WHO year is also there. So now each and every nurse can come together and join their efforts so that all these initiatives can be bring the best to the profession as well as to you. I appreciate and I congratulate each of one of you for selecting this profession, and also I wish you a safe and healthy life, and your efforts are being acknowledged across the world. Stay safe and healthy. Thank you, Dilip. Over from me.
Dr. Rati, thank you so much for that wonderful presentation that you just gave. For someone like me who works very closely with the ministry and also tries to keep a tab on most of the good things that the ministry does for the health workers, particularly the nurses and the frontline workers in COVID times, the bouquet of the initiatives taken by the government has been very educating for me. It's also very enlightening for me, and the entire the support, which is very important from right at the top, which has been unflinching and led by the Honorable Health Minister himself, has been really encouraging for all of us in the field and otherwise. And you talked about ordinance, legislature, insurance, PPEs, the whole, I can't see anything that hasn't been thought of and addressed by the government. There was just, I'm sure Pragati will also come in and maybe is also taking a note of the important questions that can be taken up in the end. But one thing which I would like you to touch upon now is the helpline number. The phone number for the helpline. It would be very kind if you can just repeat it for us again.
Yeah. It is.
Yeah.
It is set up for this is the national level, 8046110007. It's also there in the website.
Okay.
And that every state also there is a helpline, and the list of those helplines are provided, so that anybody who is having any issues, they can have the grievances, especially for the healthcare workers also. The issues related to their testing or their any worries, psychosocial problems. This dedicated helpline is for the psychosocial support. There is another number which is for the grievances.
Okay.
All aspects have been taken care.
All right. Thank you so much. Pragati, would you like to just come in for a minute, or Pragati?
Yes, thank you, Dilip. I was noting the chat box. There are no questions as of now, but I had a question. Dr. did mention that there are some incentives and provision for nurses who are with the private sector. And I'm sure in today's session, there are many participants who are working in the private sector. If you could please elaborate on that for the benefit of our participants, it would be very helpful. Thank you, ma'am.
So that That committee has come set up based upon the direction of Supreme Court, and that this the initiative taken by TNAI to approach Supreme Court with regard to the salary of nurses. Based upon that, under the chairmanship of DG, the committee has set up, and they have studied the salary of nurses and working condition across the country, and have set a minimum standard. Any institution, any place which is less than 50%, even a single nurse is appointed, the salary should not be below 20,000. That is the basic things. And any institution which is having more than 200 bed should give all the health and salary and welfare services equivalent to what is practicing in the government. This was the recommendation, and it has been well disseminated by the government and repeatedly to the state governments, because health is a state subject. So various states have taken initiative to get it implemented, and and TNAI is also following up so that it is in ground. It should be available. The nurses' needs are to be met. So it is like a collaborative effort. We have to reach. We have not yet reached that the minimum wages across the country, but the initiatives are started and the efforts are going on with the collaboration of TNAI in various parts.
All right.
Okay, Dilip, over to you.
Yeah, thank you, Dr. Rati. My last request to you, my second last request to you is please stay on till the end of the session so that you can address some of the concerns of the participants. And my last request for the time being is all this good work that the ministry has done. You know, when you go to the MOHFW website, it's very difficult to navigate and find all these, very important documents there. So if a compendium of somehow all the things that you have spelled out, if that can flash on the website or be available easily for me, you, everyone here, the 450 participants, that I guess will be one of the most important things that you can do to help us all. Thank you.
That's to convey this message. At the same time, there was a nursing and midwifery web page. Also, we will be we may think of having that, so that the things related to nursing will be in one place.
Perfect. Or maybe if you share it with this Fair India team, they can put it up on their website or something, and so that they can easily find and read and learn from there.
Questions ahead to the ministry, and the appropriately actions will be taken.
Perfect.
Will be conveyed. Thank you.
Perfect. Thank you. Thank you. Well, Dr. Rati spoke about 3 pillars. We've already ticked off one, that's the government. And then we move next to the regulators. For that, we will move on to the next resource person, who happens to be a very dear friend, a very dear and learned friend, with whom I've had the good fortune of working together on many, many occasions. I would like to introduce you. Well, he needs no introduction. You know him, most of you, all of you know him. I would like to call upon Dr. T. Dilip Kumar, who is the president of the Indian Nursing Council. He was also the project director at GFATM program and a nursing advisor to the Government of India in his past. He has more than 43 years of experience in the field of strengthening nursing system in the country. He's also worked in different capacities, starting right from there as a staff nurse and moving up to the nursing tutors, nursing superintendent, deputy nursing advisor to the Government of India, and he has also been a member of the Global Advisory Group on Nursing and Midwifery of WHO. He played a very significant role in India becoming a member of the International Council of Nurses. He is also responsible for development and establishment of state-of-the-art National Referral Simulation Center in collaboration with Chapaigo, Ladle, and SCT University in Gurugram, Delhi. I think he and his organization, it's not written on your CV, but is also largely responsible for the live registry for nurses that we have in this vast country of ours, covering thousands and thousands of nurses. Well, without any further ado, I would like to hand over the floor to Dr. Dilip Kumar. Welcome. You will have to switch off your mic. We can, yeah, unmute your mic. Maybe all right, that's it.
Thank you, Dr. Dilip.
Thank you.
First of all, on behalf of the Indian Nursing Council, I would like to extend the greetings to all the nursing fraternity in India and abroad. And today is a very important day. We could have had the National Award for the Outstanding Nurses and Midwives given by the Honorable President of India, but due to COVID-19, we are not having that very big function which we were supposed to have on this day. But definitely this has given a big fillip of because many of the nursing warriors who have worked in COVID-19 will get an opportunity in getting awards, because if you would have given the awards today, we would have missed these nursing warriors to be awarded in this 2020. And very significantly, the government of India has acceded for the request of increasing the national awards from 35 to 51. That's a very, very significant in the year of the International Nurses and Midwives, what you can think of. Because, you know, even when I interacted with many of the WHO and other international people, when they have witnessed our national award ceremony in the Rashtrapati Bhavan, I think they said that at least India is giving so much respect to the nursing fraternity in India by inviting them to the Rashtrapati Bhavan and awarding. So such a function we have missed today, but definitely we are going to have when the normalcy comes back. And definitely the nurses and midwives who have worked in the COVID-19 will get a priority in the in this national award. And more so, I think many people will be maybe knowing that this chairman of the National Award for the Nursing and Midwifery at the national level is happened to be the retired Supreme Court Judge Gopal Gowda, because under his leadership, the awards are for the last 2 years we are doing, and today also he has extended his greetings to all the nursing and midwives in India through webinar. Can I have my slide? I think I would like to focus on the legislation, but since today is a very important day, International Nurses Day, I would like to inform all the nursing fraternity and one of the things which the Nightingale Challenge and Nursing Now campaign started from 2017 to end up to the 2020 World Health Assembly, but we are not able to have that celebration in the World Health Assembly. And one of the theme was there by the Lord Nigel Crisp, who was the co-chair of the Nursing Now campaign. We as the nurses need to be supported by the non-nursing professionals. That is one of the themes which he made it, that if nursing profession has to get recognition, then other than the nursing professional like physicians, the advocates, the media, and the legislatures and the politicians, policymakers. So we need their support if you have to strengthen the nursing in any country. That's how in this respect, though in this webinar, a lot of non-nursing personnel might be participating. For their information, I would like to share that on April 7th, World Health Day, the Director General of the WHO released the the World Nursing Report. The WHO, I think WHO has really flagged the importance of the nursing and midwifery at the global level. One is by declaring 2020 as the International Nurse and Midwife, number one. And again, April 7th, the theme of the is also for the nursing. And these two things has given a fillip to the various countries. And this World Nursing Report, which is going to be very way forward for the another 10 to 15 years to come to the various countries. And he has said, while releasing the World Nursing Report, nurses are the backbone of any health system today. So that that is the DG's word. This many nurses find themselves on the front line in the battle against COVID-19. And also he has said that this report is a stark reminder of unique role they play and wake-up call to ensure that they get the support they need to keep the world healthy. So this is a very important statement while releasing the World Nursing Report by the WHO. This is the setting the floor for the discussion for the policy dialogue in the years to come in different countries, including India. Next. I think in this report, I think just I would like to share because though there is some technical typographical error, the density of nurses per, it's not 1,000, it will be 10,000. It is by mistake the typographical error. So where we are, at least no, I am comparing with the developed countries and the at least no, our neighbors, the Southeast Asia. Australia is having a 116.8 per 10,000 population. USA, we have 145.5 per 10,000 population. UK, 77.1 per 10,000 population. Canada is having a 99.11 per 10,000 population. Japan, 121.7 per 10,000 population. So this, then coming to our Southeast Asia zero region, the Nepal is having a better nurse population ratio, is 31.1 per 10,000 population. The next is the Thailand, which is having a 27.6 per 10,000 population. Sri Lanka, 17.5 per 10,000. Bangladesh and Pakistan is the 3.6 and 4.9 respectively. India is 17.3. So this is still we are way behind of the achieve the norm of the nurse population ratio compared to the developing countries. So this itself set the ball rolling for the India to the policy dialogue, how to take forward in the years to come. And also next slide. I think it says about there are 28 million nurses worldwide. The global shortfall, this report says 5.9 million gap is been projected. And this gap is in Africa and Southeast Asia and WHO Eastern Mediterranean region, and as well as some parts of Latin America. So India comes under Southeast Asia. And just to flag that, because the gap which has been mentioned is also finds a place India in Southeast Asia. The report also says that 80% of the nurses work in countries that are home to half of the world population. That means a lot of the majority of the nurses are working in the developed countries compared to in the developing countries. 1 in 8 nurses practice in a country other than they were born or are trained. This is a very significant the indicator which has been given in this World Nursing Report. And also aging also threatened the nursing workforce. 1 out of 6 of the world's nurses are expected to retire in the next 10 years. So this is I think this World Nursing Report is flagging the issue of the nursing human resource, and this will be a good indicators which has been flagged to the policymakers and to have a policy dialogue. Next. The theme, actually total theme of this 143 page of this total World Nursing Report is focusing on investment, investing in education, investing in jobs, nursing jobs, and investing in creating the leadership. This is I think there are about 12 broad recommendations are there, which has been very in evidence-based recommendations which are given in that. But I think for us to consider investment, I think the mantra of the whole report is investment for the countries. They are asking the countries invest more money in nursing, education, and creating the jobs and leadership. And this investment is also contributing to achieve the SDG goals of 4, SDG goals of 5, and also SDG goals of 8. This also report, this next. Main recommendations, I am not going, please go to the next time. These are all routine because of the time constraint. I am not going. One of the important legislative recommendations for is last but one. You go to the next. Modernize professional nursing regulation by harmonizing by harmonizing practice standards and using systems that can recognize and have credentials globally. This is one very important World Nursing Report, which is pertaining to today's webinar on the legislation. And this, I think, for the India is very much relevant on some of the legislative actions which we have to take. Next. I think one of the challenges which I was asked to speak on, well, I think there are a lot of challenges which are there. I am going to only discuss only some of the relevant. I think we all know that the nurse-patient ratio, creating the position is one of the challenges. We still, because many of our 14 nursing specialities which Indian Nursing Council prepared on the basis of the 2000 National Health Policy for training of nurses in various specialization, but we could not take forward because of the non-creation of the post, and there are no takers for this specialization. But at least now the government of India is coming in a big way of approving the nurse practitioner critical care program, which is a 2-year residency program, and also the important is nurse practitioner midwifery, where at least government of India, at least they have addressed our problem of creating the positions. At least they have calculated 84,000 midwifery-led units will be established, which means at least the positions are going to be created for 84,000 midwifery posts. I think that's a big, under the NHM, which has assured because many times we create the syllabus, we do all those things, but there are no takers. So therefore, at least in the nurse practitioner midwifery, they at least know the way forward has been created in terms of the creating the positions. And I think the midwifery educator training program has been started, and at least we'll be able to forward. Next. I said about this is where very important legislation which is required to be the legal empowerment for the nursing and midwifery practice in the community. I think the main important for today's, I think I would like to dwell upon that. And also in the next slides are there scope of nursing and midwifery practice. I would like to take these two things together. The legal empowerment, which means at least in principle, the Ministry of Indian Nursing Council has submitted the amendment of the Indian Nursing Council Act to retitle the Indian Nursing Council Act into Nursing and Midwifery Council. That is the one which already in principle the ministry has agreed. And also in principle, the process has been started for the amendment of the Indian Nursing Council Act. In that, the scope of nursing and midwifery practice, which is one of the important obstacles for the people to take on the specialization, that is going to be addressed by, they have already in principle agreed. In the Bare Act, they are going to use the one section, scope of nursing and midwifery practice. Once it is reflected in the main act, then it becomes easier for the council to come out with the regulations for the protocols, for the procedures, and various what prescriptions, to what extent they will be able to give the prescription at the. And another important legislation which has to come in is because now under the Ayushman Bharat, now 150,000 sub-centers are going to be converted as a health and wellness centers, and these health and wellness centers are going to have a community health officers. And these community health officers, the main role is going to be treatment care support in the rural area. They need to be capacity building in the legal empowerment is required. So therefore, the scope of nursing practice is including in principle already agreed by the ministry. So I don't see much of a hurdle to get it passed in the parliament. Hopefully, we were if the COVID-19 would not have been there, it would have been already, some process would have been started. But definitely, we are going to see very quickly the amendment of the act. Another important, next slide, which Dr. Dilip was mentioning about the live register, which is one of the before the even in the recommendation, the World Nursing Report, it says that next slide. One of the recommendation of the World Nursing Report is data. The first time WHO has coined the word National Health Workforce Accounts. This word has been now coined now. In future, WHO is going to ask all the countries to give the data under the title of National Health Workforce Accounts. So they are asking the reliable data. So to this extent, at least no Indian Nursing Council, way back we took this decision to have a live register, and we are very already we have printed the passbooks to be given to the unique identity cards. So about 10 lakh we have captured the data so far. We have a 10 lakh nurses and midwives and ANMs. We have photographs, Aadhaar numbers, and their where they are working. All these details are available. So I think some 2 states are falling behind. Hopefully, when this thing, I think another 6 to 8 months, we will be able to have this full process of the live register. I am telling you, this is the biggest the reforms you can think of in nursing. Once you have a reliable data, and that data will be available to the district chief medical officer, how many nurses are there in that district, how many specialized nurses are there, how many ANMs are there, how many LHUs are there, and again for the state and also for the national. So this is one of the legal reforms which has been already we have completed, and that will be. And I think even this year when WHO asked, we were able to give many of the indicators. I think another 4 or 5 indicators we could not give. I think by the next year we will be able to give those indicators, at least concerning to the nursing, because I know that even many of the regulatory bodies, they have not started the live register program, though they have started. But here live register, NRTS linked with the renewal of license of 150 years continuing education program. And another important point I want to flag is now Nursing Now campaign, Nightingale Challenge, wherein one of the theme is to train the below 34 years age of nurses in the leadership for change, leadership training program. The World Nursing Report also focus on the leadership. So we have already Indian Nursing Council and the ICN, we have signed an MOU to have a LFC program. We are bringing the LFC program, which has been implemented in many parts of the world, and the national trainers are going to come April 20th. We planned a TOT program. Trainer was supposed to come from Geneva, and because of the COVID-19, it was postponed. So this 6 days modular training program, international trainer will be coming, and after 4 months, the same international trainer will come back to India again. She will train the same 30 people, and that's how that is the strategy, and they will become the master trainers. And already the 190 employers have logged on under the Nightingale Challenge. About 8,500 nurses have been included below the age of 35 years. And we would like to give this leadership training program. When I asked personally to the Lord Nigel Crisp, co-chair of this Nursing Now campaign, how did you decide below 35 years? I had an opportunity to meet him personally, because many of my nurses were asking me, why sir, only below 35 years? I would like to have the leadership training program. But I asked him a secret, how did they decide 35 years age this thing? So he said, when the expert group was sitting for over a cup of tea, he asked his other experts group, what is your daughter's age? What is your daughter-in-law's age? What is your son's age? So they all gave a range of 25 to 35 in that family. So they felt if you train these below 35 years, they have a 25 years ahead of their in various capacities, the nursing managers, in whichever the capacity they are there, they will be able to work effectively. They can see the impact in their outcomes. So I think the scope, I will stop here. I will be willing to take questions. Thank you.
All right. That was a very interesting session. The World Nursing Report. So thank you so much for giving us a very brief sneak peek into the World Nursing Report. We've just about maybe tickled our senses to sort of get down to actually reading the report, and I expect many of the participants today to sort of take out some time, especially in the lockdown, and then maybe try and get into this report. Also, one of the most important work that is done apart from the registry, and it slipped my mind, is also this work on the Indian Nursing Act, which is being. I also was fortunate enough to again play a teeny role in that particular act. We have a long way to go, as Dr. Kumar rightly said. Density, investment, but I think the overriding take-home message for me is for the nursing profession to succeed, you need support from the other professions. Well, you could not have summed it better. Pragati, what do you say? We have about 20 minutes left. I'm sure you're keeping a track of the questions there. So should we move on to the next one?
Yes, Talib, I think in the interest of time, we will quickly finish with our 3 speakers and then take questions at the end.
All right. Sounds good. My sympathies are with any speaker who speaks in the second half of the session, because there the time crunch sort of just multiplies multifold. Our next speaker here, our resource person, is Professor Roy K. George from the Trained Nurses Association of India. He happens to be the national president of the TNAI. He is also the academic director for the Baby Memorial Hospital, Kozhikode, Kerala. Well, I practiced pronouncing that. And Dr. Roy is also senior faculty and administrator in nursing with more than 30 years of experience, and a national leader of Professional Association of Nurses. The TNAI, by the way, is the only professional association for nurses which was established long back in 1908 and headquartered in Delhi, New Delhi, with branches in all the states of pre-independent India. Well, that's the era that we go back to historically with TNAI. So I hand over the floor to you, Professor George. Thank you.
Good evening, and greetings of the Nurses Day to all of you from Trained Nurses Association of India. Firstly, let me thank the organizers for inviting TNA for this important webinar. And let me pay my tributes to the all corona warriors in India who are in a fight against the disease. And today in the morning, our Honorable Central Health Minister released the TNA's tribute to corona warriors by releasing the short film. And also I pay tributes to the nurses all over the world who have sacrificed their life while caring for COVID, especially Indian nurses who have sacrificed their life in many countries around the world. Of course, it was nice for the organizers to start with the midwifery practice by Madam years because I've been hearing about COVID too much these days, so much of webinars. So it was something positive to hear in the beginning. But let me go to the challenges of nurses in this COVID era and post-COVID era. Of course, when COVID came to India and the fight started, there was a lot of lack of upskilling in nurses, including all the health workers. Of course, the government, the regulatory, the nursing council, the professional associations like TNAI, and many of the institutions, government and private institutions, took up this task of upskilling nurses. Because to be honest, I have seen my first PPE. I have seen a PPE kit for first time when the Nipah came to our place in Kerala. Before that, I have not seen a PPE kit after so many years of experience. This was the same case with many nurses across the country because we have not familiar with such a disease, such a infectious disease of that precaution. So now that training needs are being met and at least partly met, and we are ready. Next was the issue of shortage of personal protective equipments. Though the government is mobilizing all its resources to supply it, central and state governments, still there is challenges faced by nurses in the ground because there are shortage of supply because of lockdown. Supply is reaching not in time, things like that. As a professional association, we know that we have to support nurses and we have mobilized our funds to supply as much as possible across the country personal protective equipment as a supplement to government, because this is not the time to blame the system because system will take time and it is unprecedented times and we have to take unprecedented and unusual actions that we have done. So we are not going to that things, but while we are talking about International Nurses Day, the most important stuff given by WHO was investment in health, investment in nursing and midwifery. And if you take the investment in a country like developing country like India, what percentage of GDP goes to health and especially to nursing? That is pretty very low. So where we have to start actually? That is something which we have to stress whether it is the ministry officials, the regulatory council, the professional associations, how to lobby with the government to increase the investment in nursing. It is very, very low. That is true with the state governments also. If you take the percentage of amount spent in health and nursing is very, very low. And that is what we mean, the WHO means by investment. Like the Indian Nursing Council, when the advisor, Dilip Kumar Sar was the advisor to Government of India, this investment has increased now, but there is some downward things now. We are really concerned as a professional association. As the expenses are more, the investment has to be more. That is one thing which is very important. That's a very important challenge. Budgetary allocation has to be improved in central. Of course, I think COVID is a blessing that way. It has raised concerns about health investment, health allotment, budgetary allotment for health around the country, around the globe itself. What is the amount of money spent on defense and what is the amount of money spent on health? And our fighters, the health workers and nurses are going to the field without even weapons, whereas we have lots of weapons in every country with the army. So this is a priority. Health has to be a priority to protect people. That is one thing very important. Second, when we say about investment, and Dr. Reddy Balandan was saying about what all ministry has done, I accept all that. But even in this crucial time of a pandemic, the topmost post of advisor to Government of India nursing is lying vacant for the last 4 years. It is really a concern as the professional association and every nurse. It has to be filled up because whatever is done when the availability of people to coordinate work more efficiently has never shall be forgotten. So we need. And even in capital city of Delhi, many of the major hospitals under central government and state government do not have a chief nursing officer post filled. Many posts of deputy nursing superintendents, assistant nursing superintendents, in charge nurses and even staff nurses remain unfilled, and there is shortage of staff. Whereas there are availability of nurses, this recruitment has to be done immediately, because we are sure that it is not going to this pandemic is not going to get off by just 1 or 2 weeks. We have to definitely, and this has to be filled always, not only at the time of COVID. Whenever it is there, this primary, these important hospitals of government, this post filling, filling at least the available posts are very, very important, and that will definitely increase the efficiency of nursing service in these hospitals. Of course, there are vacancies to created. I'm not going to such things, because though we say shortage of nurses, the number of posts available in government sector to care for such a big population is comparably very, very low. So even if we are bringing out nurses from the nursing colleges or nursing schools, they are not getting proper employment in government sector, which will definitely attest to the public health system, because COVID has revealed the importance of maintaining a public health care system than depending too much on the private healthcare system. Of course, we need private players also. We need collaborative efforts of private and public, but we have to strengthen the public healthcare system. And again, because from the Ministry of Health and from the WHO expert, they was talking about the salary of nurses in private sector. Though TNA won a historic case after a battle of 5 years from 2011 to 2016. And the central government committee appointed the expert committee, and they gave the recommendations. To be honest, still majority of nurses in private sector, especially in the service sector, are yet to get the wages recommended by the expert committee. Though health is a state subject, and the central government says we have sent advisories and things like that, affirmative action is not taken by all governments. Of course, as a professional association, we are again going to move courts, high courts, various high courts. In Delhi High Court, we moved the case, and in that case, in the consequent cases filed by management centers, actually, Indian judiciary gave a appreciative judgment, which will go in the golden letters in the history of nursing in India, about how important nursing is in the human being's life and healthcare. But still, there's a long way to go to assure decent salary for nurses working in the private sector. And in India, majority of nurses work in the private sector, not in the government sector. So that is very important as far as development of nursing is concerned. Though there are many trade unions in the private sector, they are also following it up. We need a concerted effort about the professional associations, the trade unions, the Ministry of Health, and everyone involved, all the stakeholders, to make reasonable pay for nurses in the private sector a reality. And things like all the independent practitioner or nurse practitioner, which has been told by the INC president, is still blocked in many places due to the autocratic attitude of some of the people of the medical fraternity. They see it as a threat, whereas it is going to be a blessing for the healthcare system, the public, and also for the nurses to develop their skills and upskill them. But that has been blocked in many places, even in this international year of nurses. Due to shortage of time, I'm just concluding, we need support from the Ministry of Health, the regulatory body, and the public, the media, the World Health Organization, to make the International Year of Nurses and the importance of nursing more effective in the post-COVID era. Of course, in the COVID era, we are getting recognition or the appreciation which even WHO may not have expected by declaring this year. But we want to continue this support to develop nursing and ensure better nursing care to the people of this sacred nation we call India loyally. Thank you very much.
Thank you, Professor George. We have done a lot, but then there's many more miles to walk. I think that's the overriding message that we got from you. And thank you for bringing in that association perspective to the whole thing, to what we have heard so far till now. So Pragati, if you are fine with this, we move on to the next speaker. Is that all right?
Yes, I think, Dilip, let's move on to the next speaker, and let's keep last few minutes for.
All right. So, okay, the next resource person that we have is Mrs. Manonmani Venkat, who's from the Society of Midwives. She is a retired lieutenant colonel and was in the military nursing services for 22 years. She's also worked for different nursing colleges as principal and administrator. She's a clinical nurse, educator, and administrator. She was General Secretary of the Society of Midwives India from 2009 till 2018, where she was involved in advocacy for leadership, safe motherhood practices, planning and conducting various events related to it. She is also a member of the National Research Society of India, Society of Midwives India, the Indian Public Health Administration, and Sochni. She has also served as a paper setter, examiner, undergraduates and postgraduates, a CAP coordinator, and an INC ad hoc inspector, an NAAC peer team assessor, flying squad member involved in staff selection, etc. At present, she works as the advisor of SOMI. Mrs. Venkat, can we please hear to you now? Thank you.
With the senior nurses of the country, as well as the young, smart nurse like Pragati Sharma. Greetings to you from the Executive Council of the Society of Midwives India, Ms. Bandana Bhattacharya, Ms. Bandana Das, Dr. Prakash Sharma, Mrs. Mithali Adhikari, the President of the Society of Midwives India at present, and from all the members of the Society of Midwives India. Challenges faced by nurses and midwives during COVID-19 pandemic. The SOMI point of view. Without wasting any much time, I will just go to the straight to the points. Can we have the next slide, please? Can you hear me? Can you have the next slide?
Yes, please go ahead.
Yeah, next one. Yeah, that is the challenges. Next one. The next one. Can you move on to the next one? Nurses are the unsung heroes of COVID-19 response. These are the few of the, hold on please. The previous slide showed few of the newspaper clips which showed the various challenges of the problems faced by nurses and other health workers when COVID-19 pandemic started. Although it is on the reduction, but still some of them are still facing the same. To summarize the various challenges faced by nurse midwives, have in this supply of protein which was faced initial period, the housekeeping staff in the COVID-19 wards, the long working hours for the nurses, although they should be working for 4 hours, 7 days, and thereafter they should quarantine. They have to work for 6 to 8 hours. Next slide, please. You hear me? Next is adequate supplies. Next slide. Violence against health workers have been, we have seen various videos in this. Just hold on. The previous one, the previous violence against health workers. We have heard that some of the midwives, when the ANMs were going to, when the ANMs were going to take the survey, they were thrown.
Mrs. Venkat, this is asked slide. Hello?
increase of infection to family friends. Can you hear me?
I can hear you. I'm sorry if I'm not following you with
The
the slide.
Yeah, the previous slide. The previous slide.
Previous slide. Okay.
The previous slide.
Is this the right one?
The previous one. Increased risk of infection, spread of infection to colleagues, family members, friends, and patients. Have quarantine and if many health workers are to the moral of the health workers, the workers are working with the COVID-19 because of many, so a direct blow to the morale of the health workers. The next one, please.
I'm so sorry for interrupting you, but I think there is some issue with the sound, maybe the internet connection. Your voice is breaking and we can't really hear you clearly.
Hello, can you hear?
May I? May I suggest
Hello?
something? Hello. Yeah. May I suggest something, Mrs. Manonmani? Is why don't you kindly try switching off the video and just shutting down the video and just joining us with the audio, because somehow the voice is breaking.
Yes.
Yeah, please.
Can you hear me now?
Yes, much better. Please carry on.
Yeah. Can you have the next slide?
The next slide.
Next slide. Sorry,
Slide.
it's still breaking up for me. I'm trying my best. My apologies.
The next slide. Yeah. The next slide. Can you hear me now? Morbid fear about COVID-19. They are all scared that what will happen to me, what will happen to my family members, what will happen to my friends. There is high level of stress among the nurses working with in the COVID-19 war. Because of their own self, whenever they cite the community, these stress, all there is inadequate selling a valid arrangement and quarantine period. This we have in this time and again, and how they have been solved. I hope. Am I audible?
Yes, Mrs. Venkat.
Am I audible?
Yes, Mrs. Venkat. Please carry on.
Huge death of COVID-19 patients. Now, care heard from on I who had could meet her daughter today. I looking and if that committee were not accept someone, they are told in various problems by the next please.
Miss Venkat, I'd like to interrupt and apologies for this. Maybe you could not use headphones and just speak from the tab or laptop audio. Would that be possible? Dilip, I'd like to take a small advice from you.
Hello.
In the interest of time, what do we do? Do we move on to another
Can you hear me?
speaker?
This is to spare India. How many more slides do we have?
Let me quickly check, Dilip.
Yeah.
7.
Can I continue?
All right.
Can I continue? Next
yes,
slide.
Yes, the next
A
slide.
position statement was made. Next slide. Next slide. Next one. Okay, I will speak. I'll speak. Just forget about the slides. Am I audible?
Yes, yes.
Am I audible?
Oh, yes,
The
Mrs.
position
Venkat.
statement was made by position statement was made by the Society of Midwives in the early stage of COVID-19 pandemic itself, and the partner midwives chapter secretaries and all the members, and with the various other activities were advocating with the government officials, meetings with nursing superintendents and labor room officials, and making lists. And some of the parts they were distributing the masks and hand sanitizers to the midwives who were not having it. They had details, the guidance champions were given, and at the moment there were awareness program was conducted, and at the moment the SOMI has decided on a help from the Society of Midwives in the site for all the mothers of the country, so which will be available to them. It is online. The decision is being done, and they are processing it. I would like to. There were many other advocacies given to all the midwives. I would like to end here. Thank you very much.
Yeah, thank you, Mrs. Venkat.
Hello.
Yes, Mrs. Venkat.
Thank you.
Mrs. Venkat, thank you so much on the certain the recognition that SOMI has for the frontline workers, especially our nurses and midwives, and the steps that you've taken. All right, so we move on to the last speaker of the evening, Mrs. Manasi Jana. Hopefully the connection will be better with you. She is from the Academy for Nursing Studies and Women's Empowerment Research Studies, which most of you know as ANSWERS. She is a midwifery teacher in the College of Nursing, Medical College and Hospital, Kolkata, West Bengal. Her keen interest is in community midwifery, and she has a number of years of clinical experience in midwifery. In her very long professional career, she developed her professional growth as a competent trainer in various midwifery training, leader, organizer with the SOMI and ANSWERS. She is former secretary of the Society of Midwives India, West Bengal chapter, and currently she is the president of ANSWERS. All right, Ms. Jana, over to you, please. Thank you.
Good evening to all. I am audible.
Oh yes,
I am
please.
audible.
Yes, yes.
Good evening. Good evening. And
Good evening.
on behalf of ANSWERS, I am greeting all of you over here and happy Nurses Day. So today I am thankful to WHO. This is a good program they have arranged, just like a virtual meeting, a conference like this. So today's I will speak on challenges faced by nurses and midwives during COVID-19 and the way forward. It is the perspective from ANSWERS. Yeah, so ANSWERS has done so many things for our nurses and midwives. First of all, the COVID with COVID, the nurses' feelings and expressions. It is uploaded time to time in the Facebook page. Our ANSWERS has created a Facebook page, and this Facebook page is handled by Kaveri Moira. She is our ANSWERS member, and she is doing well. And every day she is putting from all over India the nurses' feelings expression in a template. Please next. And this is an example of template. Here the nurses, she expressed her feelings and ANSWERS giving thanks to them. In this way, this is an example only. In this way, so many templates have been created by ANSWERS. Next. And then next initiation by answer is started documentation. That is very important because pandemic, COVID-19 is a pandemic, and it has, we know, all pandemic has come in our art every 100 years. So COVID-19 is occurring here in the art, and it should be documented. So answer felt the need for documentation. So documentation, who will be documented? There are so many literary groups are there under answer. Answer has done workshop for literary members. Who are the literary members? And they are working in the various field of nursing in all over the India. And they have done their workshop under the guidance of answers, Dr. Prakash Amma, on critical thinking and writing skill, development of their writing skill and critical thinking on the research work. So this knowledge they can apply here to write about the hospital administration and transformation of hospital, hostel dedicated for COVID-19 hospital and hostel, problems in transportation, because it is the real problem, what is going on overall all over India, maternal service in the community and hospital, and the coping of stress of nurse midwives with care of COVID positive cases. What are their feelings? What are their stress? So all these points are coming into the writing, and this all together, this writing material will be published in a book. This book name is, next name of this book is Coping with COVID-19, Nursing Resilience. This is the book. Very soon it will be released. Next word of the answers is the alleviation of suffering from AWS. AWS means alcohol withdrawal syndrome. We forgot about them, but answers do not forget them because they are the people in this lockdown period. They are suffering more. That's why on behalf of answer, the answer wrote letter to Government of India and different public health organization to take measures for AWS. Because at this lockdown period, all shops are closed, all hospitals are closed. Say they do not get any shop to be opened and do not get treatment at all from any hospital. So these measures should be taken from government. So letter was written to government and all the public health organization. And the next measures, that is the keen interest of answers. These are the advocacy. Advocacy already it is spoken by Sir Dilip Kumar. That is clinical specialization cadre. Actually, in our India, there are only mainly two cadre. One is basic cadre in nursing, and another is supervisory cadre. But there is no cadre for MSc nursing. So for the MSc nursing with specialization, in our India, there are mainly 5 specialization courses are there. But after passing out, the MSc nurses got the scope for their placement in the teaching institution or in the administration only. But there is no chance of or no scope for practice in clinical field. So their skills are just going at last after misuse. So after notice. Advocacy for midwife is another strategy or another initiation of answers, that is advocacy in midwifery course and midwifery cadre. That is already told by the sir, Dilip sir. Midwifery course means in our India, there is a nurse and midwifery course together. But we want on behalf of Somi and on behalf of Ansar, separate midwifery course. And it should be the direct entry. Direct entry means after passing through 10+2 class, they should enter directly into the midwifery course, and the duration of the course will be 4 years. And if when the midwifery course will start, and it will come very soon, the midwifery cadre will be established. And it is also the ongoing process also that we have learned from the Dr. Dilip Kumar speech. And another initiation of answers is track. Track means it is the training and technical support. Always answers are given. And the research technical support means the skill development program of the midwife. This type of training like CAMT. CAMT means Advanced Midwifery Course. Such type of training was organized by Answer. And then research work. So many research work was done by Answer. Advocacy. The main advocacy of Answer is the SOMI. SOMI is the project work of Answer. Actually, answer was set up first. It is founded by Dr. Prakash Sharma, and after that, he was formed the SOMI. SOMI is the Midwives Association. It is a professional association, and with so many plan program is executed through this. Answer is executing through this advocacy through this SOMI. And next one is the main important is the capacity building. Capacity building, it is also the research writing, skill development in the research report writing, etc. This is going on. These are the main initiation of the answers in COVID-19 and apart from the COVID-19 also. And every year the answers is doing such type of activities, that is nursing knowledge and evidence generation. It is the virtual training that is going on due to COVID. We are most used to in this virtual meeting that is already started by answers also, because before 2 years answers has a physical setup at Hyderabad, but now answers can do meeting or do any program all over India without assistance, without going to the physical structure, physical institution, physically. So thank you all. Thank you.
All right. Thank you so much. This has been such a wonderful session. In fact, I'm privileged to have been part of this. This only leaves us wanting for more. But unfortunately, time is of essence over here. Before I hand it over to Pragati, who will very ably take us through some of the key questions asked from the resource persons, my only overriding request to the Sphere India team is to kindly share these important links and resource materials which were discussed during this session that we had. All right, Pragati, over to you. Thank you.
Thank you, Dilip. And Asta has given me a few questions. So the first question, the questions are very much related to one another, actually. So the first question is to Sir Dilip Kumar, Dr. Dilip Kumar. So the question is, despite of low density of nurse-patient ratio in India, what are the reasons for brain drain in India, in your opinion, at least? Dr. Dilip, I think
you need to unmute your mic.
Let me unmute you.
All right.
Yes.
Okay.
See, the reason for brain drain is, that's why I think in the 6th-pay commission, we took the recommendation to the 6th-pay commission. The principle of the WHO was that retention of the nurses, recruit and retain. To do that recruit and retain, your salary package should be good. That's how in the government, in the pay commission, we were able to get a good package for the nurses working in the government sector. That's why the salary now, any staff nurse in a central government gets a first month salary, something like 55,000 to 60,000. Whereas in the private sector, I think range is from 5,000 to 15,000. Even a good corporate hospital is not paying more than 14 to 15,000 and as low as 5,000. So therefore, brain drain, definitely people for a greener pasture, if they are going for a better opportunities, that is one reason. Though Trained Nurses Association of India took up this issue in the Supreme Court as a public interest litigation case as a PL, and in response to the PL, the Supreme Court gave an order and to constitute a committee under the Director General of Health Services, and it was constituted. And in India, health is a state subject. That is the best way we pass on the issue to the state government. The state government still unfortunately in this, many of the private hospital establishments have challenged this order. Challenge this in Delhi court, and it's still in pending. And even the Delhi government, after issuing the circular that if they don't pay the salary, the license of the nursing homes will be cancelled. That type of a threat was given to the nursing homes that has been challenged. The reason of challenging was it has not been passed as a legislation by the Delhi government. So therefore, I think the government of India, when they circulated to the state governments, please make it a law. Until unless you don't make it a law, just executive order is not going to be, because the private sector, corporate sector, they all feel if they increase the salary, they are not in a position to make the payment to the nurses. That is their plight which they have took up to the court. So in this whole process, no, I think if they are going brain drain is there, we cannot prevent. For a greener pasture, if our nurses are going, we cannot prevent them.
Thank you, Dr. Dilip, for the answer. Next question is also very much related. And someone has asked that post the COVID crisis, most of the Western countries would be strengthening their nursing cadre because they'll already have shortages after dealing with COVID-19 crisis. So there is more chances that there'll be more brain drain and more nurses from India could go abroad and the gap might further widen. So with this problem in hand, or a potential problem, does the government and association have something in mind on how we should tackle this problem? Maybe this question should go to Dr. Rati. And if there is no strategy currently, maybe we should ask to other association and members on what can be done. Just an idea. Dr. Rati, I will unmute you.
I'm there.
Yes.
We have 30 lakh nurses registered. Out of that, active means around 23 lakh nurses are there. And every year, 3 lakh nurses are passing out. So we are also, by that means the shortage will be met. Other than that means as per the National Health Workforce Accounting, 44 per 10,000 is the requirement as per WHO, where we have the whole nursing along with the other health workforce included is coming around 56 per 10,000 population. But as far as nursing is concerned, 3 lakh nurses are passing out every year. So the seat, and moreover, along with every government medical college of nursing will be set up. And the more and more government colleges will be there. These are just some preliminary thoughts to meet the requirements. And there may not be much shortage, I feel.
Thank you, ma'am. And of course, producing more nurses helps. I think the more pressing question is, even if we produce many nurses, how do we stop them from going abroad and not working in India? So, I mean, that's a question I think we still have to look answers for. So,
can I come in? Can I come in?
Yes, Dr. Dilip Kumar.
I think one of the issue, the professional associations, I always tell them they have to make a request to the state governments and to the government of India. Optimum nurse-patient ratio is not being implemented. So once if they implement optimum nurse-patient ratio, that's why I always tell the state governments and all, even the associations, first you do a study. For example, X state, if they implement what is the optimum nurse-patient ratio, what is the requirement of that state? Request the policy makers, let them not fill it up every the first year. Let them have a target of 5 years to fill up those. So that type of a planning process is not there. Their ad hocism is there in creation of positions. They don't do the study of what is the nurse-patient ratio. I think that is until unless if you don't create the positions as per the nurse-patient ratio, this problem will continue.
Thank you, Dr. Dilip.
Pragati, can I?
Yes,
add one more point? That is, in our country, the maldistribution is there. Regional, in few regions, the number of institutions are very less. So that is also, distribution is not equal. So that's also another area where government is focusing. So that the initiative has already done to start the strengthening nursing education as well as nursing service. to save few, like in Odisha, in Chhattisgarh, even in Bihar, in Nagaland. These are some states which are focusing on strengthening nursing service as well as nursing education. So state specific as well as region specific measures are also being under the process of the government.
Okay, thank you, Dr. Dilip and Dr. Rathi. I think it's a cross-cutting issue which has to take into account creating vacancies, then filling the vacancies that has been created. And while that is happening parallelly, I think strengthening nursing education and increasing the quality of nursing education would also be essential. At least that's what I think. So moving on to another question. So I think this also will have to go to Dr. Dilip Kumar. So because you mentioned that there is the Indian Nursing Council Act is being amended. So the question is, what has been proposed into the bill as of now? If you could just give us some salient features of that.
I think already the
would be very
process
helpful.
of discussion has started in the ministry, because the bill will be given to the ministry. Ministry has already started the discussion. It's a process, because they have to consult in the ministry with the various stakeholders, and also to the Ministry of Law before it is taken to the cabinet. Once the cabinet is approved, then it will go to the parliament. It's a process, but the process has started in the ministry.
Okay, thank you so much, sir. So I think we'll end with the questions from the chat box, and maybe we can take one question from the raised hand. Asta, if you could help me with that. Who has raised their hand now?
Shall we take a question from Lina D'Souza? Lina, I'm
okay,
going to
great.
After you are unmuted, please go ahead and ask your question.
Please tell who your question is addressed to, and then please continue with your question.
Great, thank you. Lina, did you want to ask a question?
No. I have during the session the clear answer was cleared. I understood. Thank you.
Okay, Lina, thank you so much. So then shall we move on to Harshinath Sunita for her question, if she has any?
Sounds great. Harshinath Sunita, I'm going to unmute you. Please ask your question.
Hello.
Hello. Yes, Ms. Sunita, if you could tell who your question is addressed to and then ask your question.
General question. What about the in-service education? What the people are doing, the government?
Yeah. I would like to give the answer.
Okay.
Yes.
Pragati?
Yes, Dr. Rati, please go ahead.
Yeah. Government has developed a 5 weeks induction program for the nursing officer, and that has to be finished during the probation period. Then a 3 weeks promotional course for the first promotion, and the rest of the promotion leadership and management trainings are under process of developing. Other than that, government is supporting the organizations through the State Nursing Council, through government nursing institutions, around 1,65,000 rupees for training 30 nurses. 30 nurses can undergo 7 days training on various learning need assessed and identified by the organization. The funding is supported by the Government of India through the government agencies, because it is online through the electronic transfer of funding is there. So that is one step. And as I mentioned, based upon the different levels of promotion, it is the process is there to have designation wise, based upon the requirement wise promotion, the trainings for the nurses. And it is also INC has made, then it is mandatory to have 30 hours of continuing education every year, or for a renewal of license after 5 years, a mandate of 150 hours of continuing education is there. So through the Indian Nursing Council, the ministry is also
looking into the policy of continuing education, where which are the topics as mandatory, essential, or which are desirable. Like that, topics will be identified for different positions. Thank you.
Thank you, Dr. Rati. With this, we come to an end of our Q&A session. And Dilip, if you have any thing to say.
Parting thoughts.
Sorry?
Any parting thoughts?
Do you have any parting thoughts?
Yeah, I mean, first of all, yeah, you know, I mean, for once, the government sector seems to be doing well in terms of salaries and stuff, and there's not much to blame over there. It's largely the private sector, which is, yeah, I mean, but you know, the Dr. Rati was very kind enough to tell us as to nursing schools, probably more numbers than 3 lakhs passing out every year, and of course with the quality. Improvement in quality, ensuring quality in education, that should by and large help us tide over the post-COVID exodus that we foresee for nurses in terms of needs from the more developed countries. But this model, thank everyone, and trust me, Pragati, I don't know whether you went to the group chat. Apart from the many highs and hellos and
yes,
congratulations, there were a lot of interesting chats going on, and I'm so grateful to all the participants for keeping this very lively. I can also see some thank yous to you and me and the team at Sphere. So
thanks.
I think, and probably this is the last of the week-long sessions that we have had with Sphere on this COVID-19 platform, and I would like to thank the organizers and all the participants for such a wonderful reception to the whole idea, and of course this was like, you know, not because I was part of the moderating team, but I think this came out really, really well. Thank you once again to everyone. And I think we should remotely give a big hand to one another. Yeah? I'm sure a virtual clap.
Yeah.
Right.
Thank you so much, Dilip. And I think, which means there's so much demand for this kind of interaction between government, associations, and regulators. And I think going forward, these kind of interactions will bring in more solutions for the cadre of nursing and midwifery as well. So before we end today's session, I'd like to request Astha to display that slide of ours. So since today is the International Nurses Day, I'd like to read out the theme for this year's International Nurses Day, which is A Voice to Lead, Nursing the World to Health. It demonstrates how nurses are central to addressing a wide range of health challenges. So with this, thank you so much for everybody. Thank you so much to everybody for attending the session, giving your valuable inputs, and agreeing to come together in one forum to have discussion about the nursing midwifery cadre. And thank you all. So over to you, Astha, for any administrative announcements you have. Thank you.
Thanks, Pragati. Thanks, Dr. Dilip, for that incredible self-applause. That was a game changer for me.
I'm very good at this. Trust me.
Really, I learned so much. Amazing. But I wanted to extend my thanks to all the panelists, moderators, participants. Sorry that we were not able to take all of your questions, but I hope that we have all learned a lot today. Let me just take one last minute of your time and make some administrative announcements, for which I will go ahead and share my screen now. Okay, here we are. As you all already know, if you're new here and you don't know, please note that you can download your certificate of participation for attending today's session from our website, sphereindiacovid19academy.org. Please visit the website, scroll a little bit downwards. You'll see the name of this course, next to which it will say quiz. Actually, it will say certificate, my bad. Click on that tab and enter your email ID, and you will be able to download your certificate. Please note that tomorrow, our next session, it's a panel discussion. It's on COVID-19, the new normal. Please join us at 4:30 p.m. It's a little bit earlier than the sessions that we have been having this week. We will send you the emailers with all the information as per usual. Please keep an eye out in your inboxes, and for some of you in your spam box as well. And if you have any questions for us, suggestions, feedback, if you have any concerns, you want to say anything to us, please mail us at covid19academy@sphereindia.org.in, and we will try and get back to you ASAP. That's it from me. What an incredible session. Thanks to everyone for coming, and I wish you all a very good evening. We'll see you all tomorrow.
Thank you. Bye.
Thank you. Happy Nurses Day again, and bye-bye.
All of you. Happy Nurses Day.
Great job. Goodbye.
Bye.
All of you, Happy Nurses Day.
Happy
All of you, to all of you.
Yes, ma'am. Yes, ma'am.
It is nurses a voice to lead. Nursing
Nurses a voice to lead.
Nurses.
Okay, thank you for that small correction.
Saying it like
Okay, bye. Thank you.
All right, bye.
session now. Good evening, everyone.
Yep.